Successful recovery and sobriety demands that people identify and treat any co-occurring mental health issues. Maintaining and managing our mental health is part of a comprehensive recovery program. Without a plan for managing mental health, people in recovery are vulnerable to the symptoms of depression, anxiety, trauma, or other mental health disorders. The presence and lived experience of an informed mental health program will allow you to live lives guarded against relapse to either substances or process addiction. Having relationships with specialized professionals, therapists, and psychiatrists can help to maintain mental health and mood stability during the inevitable stress and life events. Hey folks, Dr. Joe here. Welcome back to my channel. I create content, support, and resources for professionals and other high achievers who want to strategically address their substance use issue with impactful tools leveraging the science of positive habits. The National Institute of Drug Addiction, known as NIDA, states that integrated treatment for comorbid drug use disorder and mental illness has been found to be consistently superior compared with separate treatment of each diagnosis. Patients with comorbid disorders have decreased treatment adherence, higher rates of treatment dropout, and negative outcomes associated with treatment objectives. The Substance Abuse and Mental Health Association, known as SAMHSA, states that the presence of two or more disorders can complicate diagnosis and treatment. Integrating both screening and treatment for mental and substance use disorders leads to a better quality of care and health outcomes for those living with co-occurring disorders by treating the whole person. If you watched my theories of the development of a substance use disorder video, you may recall that having a co-occurring disorder is one of the theories as to how a person develops a substance use disorder. I will link that above and in my description box. For the purposes of this video and also your holistic health, I want you to consider the following as possible co-occurring disorders: mood disorders, depression, eating disorders, generalized and other anxiety disorders, attention and executive function disorders, bipolar, PTSD, and other trauma, grief, and anger. When a person has both a substance use disorder and a co-occurring mental health issue, the symptoms of each get in the way of recovery. That impacts roles, the person as a partner, employee, parent in the community. When undertreated, any of the issues are vulnerable to worsening, which is then likely to exacerbate the other problems of substance use or mental health issues. Co-occurring mental health and substance use disorder is common. According to the Journal of the American Medical Association, approximately 50% of people with a severe mental health disorder have problems with substance use. 37% of alcohol use disorder and 53% of drug use disorder have a diagnosable mental illness as well as the substance use disorder. 29% of people diagnosed with a mental health disorder misuse alcohol and other drugs. Individuals with substance use disorder, 44% have personality disorders, 28% have mood disorders, and 24% have anxiety disorders. With alcohol use disorder, 25% have personality disorders, 16 mood disorders, and 16 have anxiety disorders. For combined substance use and alcohol, 51% have personality disorders, 35 mood disorders, 27 anxiety, and 46 past trauma. Together with early detection, treatment can improve outcomes and the quality of life with people with co-occurring disorders, including reduced or discontinued substance use, improvement in psychiatric symptoms, improvement in functioning, improvement to treatment adherence, improved quality of life, decreased hospitalization, reduced medication interactions, and increased housing stability, fewer legal problems, and fewer job consequences. To manage a co-occurring disorder, here's my list. Get a correct and accurate diagnosis from a specialized provider. Develop a routine to monitor your symptoms. With a specialized provider, develop a plan to include treating the co-occurring disorder. Emphasize habits that are multidimensional in benefit. Many positive habits help with treating both the substance use disorder and a co-occurring disorder. Do a timeline with your provider to develop an accurate understanding of how your co-occurring disorder interacts with your substance use disorder and severity. Create a team. If prescriptions are necessary for your co-occurring disorder, try to find a prescriber who is addiction informed and willing to work with your psychotherapist. Learn about your co-occurring disorders and make sure that your support network is also mental health informed. For more information, content, support, and tools on how to manage executive stress and enjoy life without alcohol, drugs, or over-relying on other unhealthy coping, subscribe, follow me, and check out my description or bio for a link to a free workbook on managing executive stress and help stop drinking.